Hello everyone, doctors. I am Dr. Sesha, your study buddy for MRCGP International exam, and today, on request of some of my friends, I have recorded this explanation of these ECGs, which are coming very frequently. And this is not a detailed, information about how to read an ECG and all. It is a very short tips and tricks in which you can check an ECG and find out what it could be, the diagnosis, because there are you have timed exams, right? You need to spend the shortest amount of time in the ECG reading. So this is just tips and tricks that I have found out for myself for my exams, and I'm just sharing for friends who would want to know that. And just will be very quick because we don't want to waste most of the time for others. Very quick, this is the first ECG we have here. This is sinus tachycardia. Okay, this is almost normal. Sinus tachycardia is the normal ECG format, and just that the heart rate is high. So here you can see the heart rate is high, like the RR interval is 2 boxes. So usual is up to 4 boxes is normal. So it is 2 boxes. So the heart rate is high. Okay, and see, the only thing we have to check here is the RR period. So if the R wave to R wave, you can follow my cursor, or let me get a pointer. Sorry, no pointer, but there is my cursor here. So this is the R to R. Now it is 2 boxes, less than 2 boxes, and then this is also less than 2 boxes, near about 2 boxes, near about 2 boxes. R to next R, near about 2 boxes. This R to next R is 2 boxes. So all the intervals, the RR intervals, are equal. Okay, this will be when you will come to know the importance of checking this RR interval. This is the lead strip. Okay, this is the rhythm strip, that is 2, lead 2. Okay, there's one more lead 2 over here, but don't focus on this one. Okay, the lead you need to focus, lead 2 you need to focus is on this. This is called the rhythm strip. This will be on this lower down. Okay, so it could be 2, lead 2, or it could be lead 5 also can be there. Sometimes an additional lead 5 is given. Just don't get confused. Whenever you go to the bottom line, actually you need to see the entire the strip that is coming from one end of the ECG to the other end of the ECG, and in that you will check the RR interval. And if the RR interval is constant, that means this is normal rhythm or tachycardia. Okay, that is sinus tachycardia. Okay, so this is about sinus tachycardia. We have one more picture of a sinus tachycardia. Let me just go to the next slide. Yeah, this one is very close up. Okay, this is again a sinus tachycardia. See again these 2 big boxes between 2 R waves, and again this is 2 big boxes between the R waves, 2 big boxes. So the interval is constant. Okay, in between the 2 R waves. And also here you can see like there is a camel hump. Okay, what happens is when the heart rate becomes too fast, the P wave, the subsequent P wave falls on the previous T wave. So this was the T wave and this is the P wave. So this is making a hump type like this. Okay, see again here there's a hump. Okay, this again is the camel hump. Okay, there's nothing to know more about this, and just that we need to differentiate a sinus tachycardia from supraventricular tachycardia, in which the P waves will be absent. Okay, there will be no P wave preceding the R wave in supraventricular tachycardia. Okay, that is what is the difference between sinus and supraventricular tachycardia. Supraventricular tachycardia is SVT, right? So we will go to the next ECG. So we are done with sinus tachycardia. It is only the normal ECG, just that the heart rate is high. Next, we will see the supraventricular tachycardias. So this one. So can you see this ECG? I will just zoom in also. Okay. Yeah, That's better. So this one is the lead strip, right? I told you don't look at any of the leads. Okay, first initially whenever you're given an ECG, you feel that there are too many crowded QRS complexes, just go to the lead strip. Okay, the rhythm strip. Okay, and again, so one square to another square, it is 1.5 here, 1/4 block, then 1/4, then 1/4, then 1/4, right? One big block and 1/4 of the big block. That is the difference between RR intervals. Okay, so check any 2 or 3, consecutive 2 or 3. If they are same, then this is the rhythm is regular rhythm. Okay, this will be helpful when you go for atrial fibrillation, which will be irregular rhythm, which I will show further on. Okay, so now in this case, this is supraventricular tachycardia, and you will have typical history in OSCE cases. And just wait, there's another picture that shows it's in close-up. So this is how you will see. You will see the same pattern that is repeating again and again. There will be no aberration in the pattern. So here, if this is the V3, all the QRS complexes in the V3 will remain same, look same. Okay, there will not be any aberration here. Sorry for that. And then we go to the next one. This is again a supraventricular tachycardia. Okay, we are not supposed to distinguish it from ABRT, AV and RT. No, all the tachycardias, either it is sinus tachycardia or supraventricular tachycardia. Those are the only two tachycardias you are supposed to know in the OSCE or AKT. Okay, so this one again, different distance between two RR intervals. I am going back to the lead strip. Distance between two RR intervals is two big blocks. Again two big blocks, again two big blocks, again two big blocks. Okay, so this is a regular rhythm for me. Okay, and see, this is a little slower than the previous one, right? So the previous one was 1/4 and this one is two big blocks. Okay, so next this is a zoom in picture. So this one is a supraventricular tachycardia. Can you see a P wave anywhere? No, right? So this one is the distance between this is this is a 3 square and 5. So total is one big block is the distance between two QRS complexes here. Okay, two R waves is one big block and a little more, like 6 blocks, small blocks. Okay, and there is no P wave. This is a T wave is there. There's no P wave. There's a T wave but no P wave. P wave, no T wave. Sorry, T wave, no P wave. Right? This is a supraventricular tachycardia. You will not be finding any P waves in supraventricular tachycardia. Whereas sinus tachycardia, you might find P waves if the rate is slow. If the rate is fast, very fast, then you will find a camel hump. Okay, so next we will go to bundle branch blocks. Okay, this is in a small brief about a bundle branch block. See, there is this one is right bundle branch block. Okay, this is a pattern of right bundle branch block. So whenever you see that the rate and the rhythm strip shows that the heart rate is fine, it's normal. Okay, it is not very fast. So that means the distance between two QRS complexes is near about 4 or 5 big blocks. Okay, not less than 4, not more than 5. So that means the rate is normal. So once the rate is normal, so it is not rate disturbance. So we'll check whatever any abnormalities there. So the abnormalities, what we have to check. For abnormalities, we need to check. I will tell you overall, we need to check if there is any ST elevation anywhere. Okay, so let's go back to the ST elevation. That would be better to start from. So I will go back to the ST elevation. Okay, this one was, yeah. So this one is an ECG of anterior MI. Okay, so once we see that the rate is normal, you see the rate here is not a problem. There are four squares. Okay, but looks like this doesn't look like a normal ECG on first appearance, right? There is something very different about the QRS complexes and the T wave here in V2, V3 and V4, right? So at any point of time you can have this type of ST elevation pattern. So this one is one thing as a doctor you should remember, and there's no tip to remember this. You have to remember that this is an ST elevation and how it looks like. Okay, from the close up I will show you one more pic of the ST elevation. So This one is a close-up of STMI. Okay, see, this is the P wave, this is the P wave, the Q wave, the R wave, and there needs to be an ST which is elevated, right? So this is the baseline, right? The baseline starts with this, and this is the P wave. So your T, S and T was supposed to touch this line, but it did not touch it, and it is just hanging up in the air and bouncing back again, right? So this is the pattern you will find in any of your ECGs which you'll find in the exam. They will give you typical ECGs. They will not give you very complicated ECGs, okay? And there is one more thing here, that there's a Q wave here, okay? Q waves are not normal. Very small Q waves are normal. If the Q waves are at least 2 small boxes deep, that is 2 millimeters deep, that means more than that they will be pathological, okay? So if you're given a Q wave, only a Q wave, and then there will be a labeling on the ECG that this is a Q wave MI or something like that, okay? So you can get to the diagnosis from that, okay? This one is for ST elevation. Just check the humps which are there like this, and you will find typical of these in the exam, okay? Right, so this is another rhythm disturbance, that is atrial fibrillation. So when I told you about check the rhythm strip, and whenever you check the rhythm strip, what we are checking, 4 consecutive QRS complexes, the distance between the 2 R waves you are checking, right? So here let us check the distance here. See, on apparent observation, just even if you just see this, you feel there is some irregularity, right? It doesn't look symmetrical for you. Like all the QRS complexes don't look alike, and then once you go near, you check the R wave to R wave. Here it is 2 boxes, 2 big boxes. Here it is 1 big box. Here's 1.5 big box, 1.5 big box, again 2 big boxes, then 1.5 big box, right? Again 2 big boxes. So this is changing, ever changing QRS complexes. The only one you will be given in the exam is atrial fibrillation. Okay, this is for OSCE as well as EKT. Okay, so this one is your atrial fibrillation. So could you identify? Don't check anything else. No need to check P, everything, nothing. Okay, only you check, and then you can check the vital chart if the rhythm is given, like regular rhythm or irregular rhythm is given, or you can just check the pulse, and then they will tell you about the rhythm is regular or not if it's OSCE. Okay, so this one is typical atrial fibrillation. So I'll show you one more ECG, you will be able to identify. Now this one is the rhythm slip, right? Rhythm strip, the last one, which is extending from one side till the other side of the ECG paper which you're having, right? So in this you can check. Okay, I will start from the first one. So this QRS complex duration, R to R duration is around near about 3 boxes, and then the next one is near about 2 boxes, then the next one is near about 4 boxes, the next one is near about 5 boxes. Okay, so this one is definitely not normal, and it is irregular as well as irregularly irregular. So this one is typical atrial fibrillation. Okay, so again, rhythm strip. So this one is a different one. Okay, this one is left bundle branch block. Okay, so just let me show you a clearer picture, and then we will come back to these ECGs. Yes, this one is left bundle branch block, what we are supposed to expect. So once you see that the rhythm strip is fine, it's normal, the rhythm is normal, then you will go for any abnormalities in the pattern of the waveforms of the ECG. So the waveform of, once you, otherwise in the rhythm strip itself, if you find atrial fibrillation, you will not think about left bundle branch block, right? So you have only one diagnosis for an ECG in the exam. So if in the rhythm strip you find nothing abnormal, it looks all normal, then go for the pattern, and then go for V1 to V6. You check from V1, V2, V3. If in the V1, V2, V3 you find there is no positive R wave, okay, and see, is there an R wave? R wave means a positive wave, right? The first positive wave is an R wave, the first negative wave is an S wave, right? So there is no R wave here, right? This is the R wave, right, in V6. Okay, R wave is a positive deflection, S wave is a negative deflection. There is no positive wave in the V1. From V1 to V3, there is no positive wave, and the QRS complex is usually 2 to 3 boxes. Sorry, 1 to 2 boxes. So this one is 1, 2, 3, and 3.5 boxes. So there is a wide QRS complex. Okay, and there is no positive deflection, Okay, and then once the negative deflection has a small notch in the between, so it looks like a W. Okay, this is a typical W which you will not find. Okay, you will only find a V most of the time. So just remember, whenever there is left bundle branch block, you might not find a W. You will find a V. Okay, there will be only a single negative deflection. Just there will be a wide QRS complex, and wide QRS complex is not very common. So it could be a left bundle branch block. Okay, and if patient is coming with chest pain, it could be an MI. The first presentation of an MI is left bundle branch block. Could be there. Okay, so that's all about the clinical thing, but this one is about the ECG. So this one is very typical. I will show you other ECGs how it usually appears in an ECG. It will not be like this W. Okay, and then whenever there is a W, there will be a opposite reflection in the V6. If there's a W in V1, you will have a V6. An M in V6. That is V4, V5, V6. In these three leads, you will have a M. Okay, we are seeing this. There's an M pattern, right? There's an M pattern. Okay, that is there's a notching here at the tip of the waves. Okay, so next let's go to the actual ECG. This is just a drawing, right? We'll go to the actual ECG, how you will find a left bundle branch block. See, this one is one typical left bundle branch block pattern. Okay, and now you will say that this one is right bundle branch block, right? It looks like an M, right? The first deflection is an M, right? But no, this is not right. See, you don't have an R wave in the V1, V2, V3, right? This one, there's a peaked T wave, so this is distracting. But check here, this one is the R wave. Okay, this one is the R wave. This one is the R wave. Did you find a big positive R wave in V1, V2, V3? No, right? So the typical W which we were supposed to see in left bundle branch block, we don't find it on the ECG. So how we will distinguish? See, there is only a V wave. Okay, there's a very deep V wave, and there's a very broad base. Okay, and this is not usually a broad base. This is around 4.5 blocks. So that is a broad QRS complex. The QRS complexes are broad, and there is a negative wave in V1, V2, V3. And did you see the notching? Oh, there's a very small notch you can see only in V3, right? And then V4, V5, V6. Okay, you got a positive wave here, and there's a notch. Okay, there's an M, and there's a small M. Okay, this is not typical distinguishable, but this is the routine ECGs you get, okay, in the exam. So you cannot find if there is a left bundle branch block. The only thing you can find typically is a wide QRS complex. A wide QRS complex, okay, with no positive R waves in V1, V2, V3. That is what you will find in left bundle branch block. Okay, see this one is another one. These are the typical ECGs I have collected, and see again there is no W. You can't see the W here. Okay, but then how you will distinguish? This is very wide. This is very wide. This is not normal. Okay, I will show you a normal QRS complex. See, look at the QRS complex. This is 3 squares, more than 3 squares. V2, more than 3 squares. Let me show you a normal QRS complex. Right, this is sinus tachycardia. Can you see how wide the QRS complex is? Not more than 2 small squares, right? Should I zoom in? Okay. See, 1, 2. Okay, that is a normal QRS complex. Only 2 small squares. Okay, so anything more than that is wide. So if there is wide QRS complex, in our exam it could be either a left bundle branch block or a right bundle branch block. Okay, so we'll go back again to our left bundle branch block. Yeah, so this is a left bundle branch block. So now you can clearly appreciate that this one is a wide QRS complex, right? And this is a wide QRS complex, and then there is no positive. There is no positive R wave in V1, V2, V3. All you can find is a deep S waves, right? This is left bundle branch block. What you will do? Send to the hospital. Okay, so we don't find a typical W. That's what I wanted to show you, right? So now right bundle branch block. Of course, in right bundle branch block, as they say, bilium and marrow, right? Bilium is for W and M is for left bundle branch block, and marrow, M in B1 and W in B6 is for right bundle branch block. So right bundle branch block, I'll show you the drawing. See, here you are finding a positive wave and then a positive wave, and then this looks like an M, right? It's a typical M. You will find this. Okay. So that means there is a positive R wave in V1. V1, V2, V3, if you're finding a positive R wave, and see again there is a wide QRS complex. So your Q starts from here and your S is ending here. So it is near about 4 squares, okay? Again 4 or 3 squares. So this is again a wide QRS complex, but there is a positive deflection in V1. Okay, this one is M. Okay, this you can find as M. Okay, and V6. Okay, in the V6 you have a W. There is the W. So you can see a Q wave, that is if one limb of the W, then there is an R wave, then S is there. So that is the W. Okay, and there's a small notching over here, which could be significant or not significant. Okay, so let's go back to the actual ECGs, and we have done with the drawing. So this one is a right bundle branch block, and see, you can find V1. Okay, you found a positive R wave and a wide QRS complex. Wide QRS, positive R wave in B1 is right bundle branch block. Again, B2, you have the typical M. Okay, B3, you didn't have the M, but you have a positive R wave. And then you go back to B6. Okay, you have a W. Cannot say this is a W, right? See, it is difficult to say whether it's a W or not. But then you will have this M. So in any part of the ECG, if you find M's and W's, you think it is bundle branch block, and then go deeper into it in which leads. B1, B2, B3 you are having an M, or V3, V4, V5 or V4, V5, V6 you are having an M. That will differentiate you from right and left bundle branch blocks. Okay. So again, this is a right bundle branch block. You can see the typical M, right, in the V1. So rather than the M, you can see a positive R wave with a wide QRS complex. That is more differentiating and distinguishing than your M, which they say in the materials which we are reading. Okay, again, see, can you identify this as a W? It's very difficult to say this is a W. Okay, but then since you identified an M, that means this is right bundle branch block. You don't have to have a reverse, that is a W. You don't have to have a W to find it, conclude it as a right bundle branch block. If you have an M anywhere, you can think in V1, V2, V3 it is a right bundle branch block, and M in V4, V5, V6 is a left bundle branch block. Okay, those are only tips and tricks which I have remembered for myself, and which will help you in the finding out the ECG in 1 second. So I think that's all. Yes, there was one more that was yes, premature ventricular contractions. Just give me a moment. Yes, so we were left with one more topic that would come in the OSCE exam or in your EKT exam. So this one was premature ventricular contractions. So whenever you see an ECG like this, you see your QRS complexes are not uniform. Okay, so what we are always concerned about the QRS complexes. So you have a QRS like this. Okay, this is a normal QRS complex, but this looks abnormal. This looks pretty abnormal. This looks pretty abnormal and different. Again, this is a normal complex. This is a normal complex. Okay, this again looks pretty abnormal, right? Then you go to the rhythm strip. Okay, don't consider this as an atrial fibrillation, right? Because again, you will count the QRR intervals, and then you will think this is atrial fibrillation. No, if you count the distance between two similar QRS complexes, that is same. See, this is around 7 squares, and this again is around 6 or 7 squares, right? Again 7 squares, again 7 squares, again 7 squares. So this is a regular rhythm, okay, but there is something abnormal about it, that there are some excessive waves that are coming in. This is a different wave, and this is a different wave, and these are not same. Okay, these are different type of waves that are coming in, which, see, these two are similar, and then these two are similar. So these are different waveforms which are coming in between an regular rhythm. Okay, so this is your premature ventricular contraction ECG. Okay, so here there are very frequent. So whenever you're seeing the rhythm strip, that is 30 seconds. In 30 seconds, how many QRS complexes you have got? Extra 1, 2, 3, 4, 5, 6, 7, 8. So in 30 seconds, you got 8. Okay, that means in 1 minute, you will have 16, right? So if in 1 minute it is more than 10, you are supposed to refer this case. Okay, if it comes in your OSCE. That's how you will decide. Okay, so if it is more than 10 per minute, so this is a 30-second rhythm strip. If it is double the number of QRS complexes in a 30-second, the abnormal QRS complexes. So this one is the abnormal one. This is the abnormal. This is the abnormal. You count the abnormal complexes, and then if it's more than 10, you are supposed to refer it. And of course, the patient condition. If it is only one, still the patient is unstable, you will refer. Okay. However, that is the clinical part, but we are just identifying this ECG as a premature ventricular complex. Okay, so this one is coming after every normal QRS. You are getting an abnormal QRS. This is normal, this is abnormal, this is normal, this is abnormal. Okay, so this is a premature ventricular contraction. So this one is another ECG. You see here there is only one. There is no rhythm strip given, but then you can see one, and this is normal ECG. This is normal QRS. This is an abnormal QRS. There's a normal QRS complex and there's an abnormal QRS complex. Okay, so here's the abnormal QRS complex. Okay, so this one is a close-up. See, you are having this normal QRS, normal QRS, normal QRS, and then suddenly there is this something coming up which is very abnormal. Okay, this one is your premature ventricular contraction. You don't have to know what it is and all, but it looks abnormal and it is out of place here. It is coming in between. It is a premature ventricular contraction. Okay, for your exam, you don't have premature atrial contractions, only premature ventricular contractions, right? I mean, that is most common and expected ones. Okay, this one is your abnormal one. Okay, so that's it. We are done with our common ECGs, and this was a recording for a friend, but however, for the benefit of everyone, I will share it in the group. Okay, thank you.